The EID we decided to do was anthrax. My name is Ariba Javed and my partner's name is Harleen Carr. So in this presentation we'll be talking about 3 different types of anthrax. The first being cutaneous anthrax, second being intestinal anthrax, and the last one being respiratory anthrax. The first one we'll be focusing on is cutaneous anthrax. This occurs when people touch contaminated animal products like wool, bone, hair, and hide. A symptom of this would be a skin lesion, which is rarely painful, but if left untreated, the infection can spread and cause blood poisoning, which is fatal in 1 in 20 cases. The next one we'll be talking about is intestinal anthrax. This is caused by consumption of contaminated meat. A symptom of this is it produces severe food poisoning type symptoms leading to fever and blood poisoning, which is frequently fatal. The last type of anthrax we'll be talking about is respiratory or inhalation anthrax. This happens when spores are breathed in by the patient and lodged in the lung. The symptoms of this are similar to the flu, but they rapidly worsen, and the patient usually goes into some kind of shock between 2 and 6 days later. This is also frequently fatal. So to give you guys some background on anthrax, it was originated in Egypt and Mesopotamia. A scientist by the name of Robert Koch studied Bacillus anthracus, the bacterium that causes anthrax. He discovered that the bacteria formed spores and were able to survive for long periods of time and in many different environments inside the body. Anthrax is usually found in South and Central America, South and East Europe, Asia, and Africa, and it's also seen in cattle or other hoofed animals. Anthrax usually spreads because people eat raw meat from infected animals, or they work with those infected animals who have the disease within them. So there are ways to treat anthrax, which include living antibiotics that are given to anthrax patients to cure this disease, particularly the cutaneous variety. These antibiotics include ciprofloxacin, or better known as Cipro. There is also a vaccine against anthrax, but it's not recommended unless you're at high risk, such as somebody that works in a meat industry or lab scientists who handle the disease. Some fun facts about anthrax include that it can be used as a bioweapon, which it was once used in the history of the United States. Anthrax is also extremely rare in the United States outside of bioterrorism. Anthrax is not contagious from person to person. The only way you can contract it is if you were in contact with a contaminated animal. As we mentioned before, the bacteria responsible for anthrax is called Bacillus anthracus. Another fun fact is anthrax can get inside your body and cause disease in 4 different ways. You can get anthrax through your skin if you touch something that is contaminated with the bacteria. You can get it if you inhale the bacterial spores, which are colorless and odorless. You can get it through your mouth if you eat contaminated meat, or through your bloodstream if you inject anthrax-contaminated drugs. The last fun fact we have is that anthrax symptoms depend on how you were infected. So if you were infected by touch, your symptoms will be a lot less severe compared to if you were contracted it through inhalation of the spores.